Hello and welcome back to this YouTube channel. Welcome back to this video lecture series, and on this playlist, this is a continuation of our introduction to health education. On this lecture series, we are going to present the different theories related to health education. As we all know, theories are very important in the practice of our profession, because in some way it lays a foundation of our practice. It can be the standards of our practice, guide of the practice. It can also be a predictor of certain events or scenarios. And the nursing theories that you have learned in your TFN is also applied to our subject health education, and this is also a good these are also good guides in conducting health education session from the start, during the session, and until the person may be influenced or persuaded to practice a good healthy lifestyle. So I chose here, I personally chose four theories here, because other theories will be discussed on the succeeding video lectures. So let's start. The first one is the theory of health promotion, which is proposed by Nola Pender. I know you're familiar with her because of your subject in TFN, or Theoretical Foundations of Nursing. And this model emphasizes actualizing health potential and increasing the level of well-being using approach behaviors rather than avoidance behaviors. So when you say approach behaviors, your approach is attaining maximum health or a level of well-being, rather than avoidance of disease or illnesses. And that is why it has been classified as a health promotion model rather than a disease prevention model. So according to Pender, she defined health as a positive dynamic state, and it's not merely the absence of disease. So it is somewhat similar to the World Health Organization's definition. So when you say dynamic, it changes, it evolves. So as we all know, it is really seen throughout someone's lifetime. Okay, as we grow, whether in quantity, quality, our health also changes. Our health needs and concerns also changes. So according to Pender, health promotion is directed at increasing a client's level of well-being, and it describes that it's a multidimensional nature of a person as he or she interacts within the environment to pursue health. According to her, also health promotion is is a behavior motivated by the desire to increase well-being and actualize human health potential, as I've mentioned earlier. It is an approach to wellness. And on the other hand, health protection or illness prevention is described as a behavior motivation having the desire to actively avoid illness, detect the early signs and symptoms, and maintain functioning while the person is in the illness constraints. So that is a clear difference of health promotion versus health protection. Again, health promotion is the motivation to increase well-being and to reach human health potential. And again, protection, on the other hand, is focused on illness prevention, avoidance of diseases, and detection of the early manifestations. So we have here on this next presentation the health promotion model, This diagram um, explains what the theory is all about. Okay, but in reality, the audience may have a hard time to understand the model, or may have his or her interpretation, uh, comparing it with the definition, with the definitions, with the interpretations of the author. So we have researched the interpretation, the meaning of this model, and we are going to present it likewise with the different theories to follow. So as you can see, there are three concepts or three phrases above the diagram. One is individual characteristics and experiences. Okay, so this pertains to prior behavior of a person, and this also pertains to personal factors. Okay, so individual characteristics and experiences are prior related behaviors and personal factors. While we have the next one, behavior specific cognitions and affect. Okay, this pertains to the perceived benefits of action, perceived barriers to action, perceived self-efficacy, activity-related affect, and interpersonal influences and situational influences. So as you can observe, while I was mentioning these concepts, these phrases, it is somewhat aligned, okay, to the diagram. Okay, for example, this individual characteristics is aligned here with the prior related behavior and personal factors, while on the other the middle part we have the behavior specific cognitions and affect, and these are the uh, factors under it. And the last one, which is placed here above, is behavior outcomes. So it pertains to commitment to a plan of action, immediate competing demands and preferences, and also health promoting behaviors. To further explain, when we say personal factors, these are categorized as biological, psychological, and social cultural factors. These factors are predictive of a given behavior, and they are are factors in shaping the target behavior of the person. And when you say personal biological factors, it includes the following variables. We have the age of the person, the gender, BMI or the body mass index, the strength, agility, balance, and the like of a certain person. Um, we also have these personal psychological factors. In this variable, it includes self-esteem, the person's motivation, the person's competence, perceived health status, and definition of health. So you will also consider the person's own definition of health, like what you do with, if you're familiar with your Gordon's 11 functional pattern number 1, health and health maintenance or health management. We commonly ask the patients with their definition of health and illness. So it's somewhat subjective. And the third one is under personal characteristics is personal social cultural factors. So this variable includes race, ethnicity, socioeconomic status, educational attainment, and also acculturation of the person. Moving on, we have this perceived benefits of action. So benefits here are usually related to positive outcomes. So that is what benefits of action focuses on. It is the anticipated positive outcomes that will occur from a health behavior. Then moving down, we have the perceived barriers to action. These are also anticipated or even imagined or thought um, blocks and personal costs of understanding a given behavior. So these are the variables that may cause uh, as a barrier for the person to practice a healthy lifestyle. Then we have also perceived self-efficacy. This is the personal capability, the own judgment of the person uh, to organize and implement health promoting behaviors. So since this is self-efficacy, he or she will dictate if the person can do the health promoting behaviors or not. Okay. um, Perceived self-efficacy influences perceived barriers also. So the higher the efficacy results in lowered perception of barriers. So they are indirectly related to one another. As one variable goes up, the other variable goes down. So again, the higher the efficacy, the self-efficacy, the higher the judgment that a person can do the health behavior, the lower the perception of barrier, and that would mean the person is leading to a healthy lifestyle, or let's say healthy state. Then we have, I think this is the fourth one, activity related affect. Okay, these are subjective positive or negative feeling that is usually occurring um, before, during, and following behavior based on the stimulus properties of the behavior itself. So when you say activity related affect, it influences self-efficacy, which means the more positive the subjective feeling, the greater its efficacy. And in turn, increased feeling of efficacy can generate a more positive affect also, or the more that a person will practice healthy lifestyle behaviors. So that is the interrelationship of activity related affect, perceived self-efficacy, and perceived barriers to action. Okay, then how about interpersonal influences and situational influences? So when we say interpersonal influences, this pertains to cognition concerning the behaviors, the beliefs, the attitude of others. So since we're talking about interpersonal influences, this comes this come from other people. um, these are usually expectations of others, expectations of your family, of your significant others, or in a positive note, it can be also a support from other people, like they can be instrumental to your good practice on health. They can be an encouragement to practice, and these are people who uh, can be models. Okay, meaning the patient can learn from their experience. Okay, in the theory of Bandura, the he mentioned this as vicarious experience or vicarious learning. Okay, this is usually achieved through observing others engaging in a particular behavior, whether it's unhealthy or healthy behavior. The point is, these are experiences of others. and the patient is learning from this experience. Okay. Um, Primary sources of interpersonal influences are usually the families, the peers, and healthcare providers. So, us being healthcare providers can be models also. It can be interpersonal influences also to our patients. So that is what I was referring to last time, that um, we should be also role models to our patients later on, when we become nurses. And we have also situational influences. These are personal perceptions and cognitions of any given situation, okay, or context, scenario, that can facilitate or prevent the person, or impedes the person's behavior. So this include perceptions of options available, the demand characteristics, and also the aesthetic features of the environment in which the healthy or health promoting behavior is proposed to take place. Situational influences may have direct or indirect influences on health behavior. So those are the two other constructs or variables under behavior specific cognitions and affect. So again, under behavior specific cognition and affect, we have five, okay, or six. We have six constructs or factors. Under this, we have perceived benefits of action, perceived barriers to action, perceived self-efficacy, activity-related affect, interpersonal influences, and situational influences. Under the behavior outcomes, we have three, okay, constructs. We have commitment to plan of action. So this is a concept of intention. Okay, since we are talking about commitment, okay, or commit, this is the concept of intention of the patient, of a client, of a person, to have a strategy that leads to implementation of healthy behavior. So the commitment is very important in achieving or implementing healthy behaviors, especially when a person comes from an unhealthy lifestyle or behavior also. Then immediate competing demands and preferences. When you say competing demands, these are alternative behaviors which individuals have low control because of environmental reasons, such as work, family care responsibilities. Competing preferences, on the other hand, these are alternative behaviors which individuals exert relatively high control, such as choice of food, okay, choice of activities, okay. So these are your preferences, okay. So for example, of food, are you during your snack time, what do you want, like ice cream or apple for snack, okay. So that is competing preferences. Okay. Then we have health promoting behavior. Health promoting behavior is an endpoint or an action outcome directed towards attaining the positive health outcomes, such as optimal well-being, personal fulfillment, and productive living. So these are the constructs under behavior outcome. And to end this model, um, the assumptions of Nola Pender, health promotion is a as this a theory that nurses are considered important we as nurses, we are called to motivate the patient, we are called to empower the patient, we are called to educate the patient, counsel, be a support to the patient in achieving healthy behaviors. And in summary also, um, the model focuses on helping people achieve higher levels of well-being, and not only to prevent disease but to pursue better health or the ideal health. So the four assumptions here are: first, individuals strive to control their behavior. Second, the individual work to improve themselves and behavior. Then third, health professionals comprise the interpersonal environment. Fourth, self-initiated change is essential to changing behavior. So again, may I repeat the four assumptions to summarize the whole theory. First one is individuals strive to control their behavior. Second, individuals work to improve themselves and their behavior. Third, health professionals comprise the interpersonal environment. Then fourth one, self-initiated change is essential to changing behavior. So that is somehow related to your commitment, to your intention, okay, to your self-initiated behavior to change. Then second theory in this health education playlist, we have Albert Bandura's self-efficacy theory. Okay, so self-efficacy is the single most important aspect of the sense of self that determines one's effort to change behavior according to Bandura. It is equated with self-confidence in one's ability to successfully perform a specific type of action. So, and if you try as this interpret it, the higher the confidence of the person, the higher the success that he or she will perform or implement a certain health behavior. The lower the self-confidence, the less successful the performance of a specific healthy behavior, lifestyle, or actions or activities. The term self-efficacy was first coined by Albert Bandura in 1977. He is a Canadian-American psychologist and a professor of one of the famous universities in America, Stanford University. And he originally proposed that concept in his own words. Okay, so one of his lines in his studies is how well one can execute courses of action required to deal with prospective situations. So under this self-efficacy theory, there are four constructs, as you can see in the image. We have here performance outcomes, vicarious experiences, psychological feedbacks, and verbal persuasion. So self-efficacy is a person's particular set of beliefs that determine how well one can execute a plan of action in prospective situations, according to Bandura. And to put it in more simpler terms, self-efficacy is the person's own belief in their own ability to succeed in a particular situation. Okay, I made an analogy later. The higher the belief, the self-efficacy, the higher the success of performing a healthy behavior, the lower the self-confidence, the lower the self-efficacy, the lower also the chances of implementing a particular health behavior. So we have the first one. Okay, the most influential source is the interpreted result of one's previous experience or mastery experience. Okay, when we talk about mastery experiences, this refers to the experiences one gains when they take on new challenge and are successful at doing so. Um, Mastery experiences are the most influential because they provide the most authentic evidence of whether one can master whatever it takes to succeed. And success builds belief in one's personal efficacy. And failure, on the other hand, undermines it, and especially if failures occur before a sense of efficacy is firmly established. So failures can also affect one's self-efficacy. Okay, so if failure sets in before the plan of action, uh, the patient or the person might quit earlier. Okay, and one of the best proven ways to learn a new skill or to improve one's performance in a given activity is by practicing it. Okay, by practicing it. So we are talking about performance outcomes. How can the patient be sure that practicing and acquiring new skills will lead to most positive experiences? In most cases, part of the reason this works so well is that the patient unknowingly throughout the change process, transformation process, are teaching themselves that they are capable of acquiring new skills. Okay, so they are the trainers of themselves also. Usually, since we're talking about a psychologist here in the person of Bandura, it's how you influence your mind, or how your mind influences you also. um, it's a vice versa situation. Then we have here the second important source of self-efficacy is through the experiences of others. So that's your vicarious experiences. Okay, these are, as I've mentioned earlier, in Nola Pender's health promotion theory, these are provided by role models, by social models. According to Bandura, seeing people similar to oneself succeed by sustained efforts. Okay, this is raised by observers, believe that they too possess the capabilities to master comparable activities to succeed. Vicarious experiences involve observing other people being successful on a certain activity, a certain task, a certain health action. When one has a positive role model in their life, especially those who display healthy behaviors, healthy lifestyle, um, or a high level of self-efficacy, one is more likely to absorb what he or she is observing, at least a few of those positive practices and beliefs about oneself. Role models include, as I've said earlier, the families. It can be friends, can be counselors, can be us, the healthcare providers, and also the relatives and professional life coaches. Okay, or even employers, the bosses, the leaders of a certain institution uh, can be a role model. Just like you, when I asked you during the first day, why do you choose nursing? Some of you, or a few of you, answered because you have a model. Okay, it's whether your parents, your relatives, or a nurse that you met in your earlier life. Then third is receiving positive verbal feedbacks, okay, or psychological feedbacks while you are doing, or while the patient, the client, is doing a certain task. So receiving positive feedbacks will persuade a person to believe that uh, that that he can succeed in a certain skill, in a certain capability. For example, a patient who is diabetic and have insulin as a medication, so that is usually self injection, um, and the person at first can be or might be afraid of the needle, of the syringe, but later on, as part of his transformation, verbal persuasions, or sorry, feedbacks, positive feedbacks affect may affect the transformation for the person to have his own self injection. Self-efficacy is influenced by encouragement and even discouragement. So it's either positive feedback or negative feedback. Okay, this pertains to the performance or ability to perform a certain skill or performance. Okay, so that is verbal persuasion. Um, Verbal persuasion also works on any ages, but according to the theory, the earlier it is administered, or the earlier that you give feedbacks, the more it is likely to be encouraging. Okay, especially positive feedbacks for the person to increase his or her self-efficacy. Then last construct, um, the verbal persuasion, the emotional, physical, and psychological well-being of a person can influence how a person feel about their personal abilities in a particular situation. Okay, so for example, um, a struggling person from depression or anxiety, one might find it harder to have a healthy level of well-being. So, is it possible for the person to build self-efficacy even he or she is on depression or extreme sadness? Sometimes, most of the time, no. Okay, because he has low level of self-efficacy, he is depressed, he is extremely sad. Okay, but boosting the self-efficacy is much easier task when one is feeling healthy and well. Okay, however, according to Bandura, it is that um, self-efficacy is not merely an intensity of emotional and physical reactions. Okay, but according to him, it is rather how they are perceived and interpreted. People who have high sense of efficacy are likely to view their state of uh, of mind, of body, as a facilitator of performance, whereas those who are beset, okay, by doubts or self-doubts, regard their arousal as debilitators. So that is coming from the own words of Albert Bandura. Okay, so again, for verbal persuasions, this is affected by uh, encouragement and discouragements. Okay. So that is the self-efficacy theory. And third, we have Becker's health belief model. I know you're very familiar with this if you have happened to finish your fundamentals of nursing. Okay, this is according to Becker, and health belief model was originally developed to help explain certain health related behaviors. It has also helped to guide the search for why these behaviors occur and to identify points for possible change. And also to this model also help to have a change of strategies. Okay, that is likely to persuade a person to make healthy decisions. A model, okay, So Becker's health belief model is a model that can be used to guide health promotion and disease prevention programs. It is usually used to explain um, and predict individual changes in health behaviors, and it is one of the most widely used models for understanding health behaviors. Okay, so we have here in the next presentation the model, the illustration. Okay, so the focus of this model again is on individual beliefs, okay, about health conditions, which these beliefs may predict individual health related behaviors. Okay, the higher the belief, maybe the higher or the lesser the person may also do a or change in behavior, may have change in behavior. This model defines the factors that influence health behaviors as one, individuals perceive threat, okay, um, to certain sickness or disease. So that means your susceptibility, the person's perceived susceptibility. So taking for example, in your own understanding, or in your situation, applying it here in this time of pandemic, okay, what is your perceived susceptibility in terms of COVID virus? Okay, do you think you are susceptible or not? Okay, so if you think you are susceptible, you may follow, you may highly or really follow the health minimum, the minimum health standards set by the IETF and the WHO. But if you think you are not susceptible, again, the lifestyle will change, okay, will be affected. Then we also have belief of consequence. This pertains to perceived severity. Again, taking for example COVID, if you think that COVID has no severity at all, your what's this, your lifestyle, your behaviors is affected. If you believe that the consequences are really severe, are really life-threatening, so again, your behavior is affected, your lifestyle is affected. Another factor is your potential positive benefits of action. So this pertains to perceived benefits, okay, perceived benefits of doing some actions. It's either since we are talking about benefits in relation to COVID-19, what is the benefit of using mask? What is the benefit of quarantine? What is the benefit of washing your hands, of physical distancing? Okay, and you, if you on your own selves perceive the benefits of it, high chances are you are going to maintain these practices. And fourth one is perceived barriers to action. The exposure to factors that prompt actions also. These are your cues to action. Cues to action may be your signs and symptoms. That's a cue. Okay, right? For example, you're experiencing cough, you're experiencing fever or colds, then you're suddenly cued, okay, or hinted by or triggered thinking the manifestations of COVID-19. So what are you going to do? Okay, because you are familiar, you are knowledgeable with the signs and symptoms of COVID-19. Okay, so that is a cue for you to act upon or act on something. Then another one is the confidence in ability to succeed. That is also self-efficacy. Okay, that's also one of the factors in this self-belief model. Um, So that is the brief discussion on health belief model. Again, it focuses on the four perceived factors: perceived susceptibility, perceived severity, perceived benefits, and perceived barriers to action. To end this, when you say barrier, why would you, or why would the client, or what's the reason, the factor that the client will not do this? Okay, healthy behavior lifestyle. And the last one for this playlist, for this video lecture, is Green's precede proceed model. Okay, so this theory is based, or this model is based on epidemiological perspective on health promotion to combat the leading causes of death. So since we're talking about epidemiology here, we're referring to the community as a client, not only on a certain individual or family, but again the whole community. The acronym stands for PRECEDE, or the meaning of PRECEDE is predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. And on the other hand, PROCEED stands for policy, regulatory, and organizational constructs in education and environmental development. So this is kind of challenging model to really study, or to scrutinize, and let's try to simplify it. Okay, so this model provides a structure within which you plan your work. So that is uh, the reason for this model. Okay, for you to for healthcare providers to plan their work in such cases that there is an increasing case of diseases, if there are epidemiological situations or epidemics that are happening, so that this team of healthcare providers will not be guessing, will not be grasping, or like having difficulty on how to plan their actions. So as a result, the team is more likely to develop a very good plan or coherent plan that addresses the issue. Okay, it also provides a template for the process of conceiving, planning, implementing, and evaluating a community intervention. And community involvement is also very important here, meaning when you say community involvement is the active participation of the community people. Okay, this is a partnership, okay, between the healthcare providers and the community people. Though the community people or the community should have the sense of ownership, okay, of interventions, and this leads to more community support and greater chance of success. Okay, so the higher the community involvement, or the participation, or the empowerment, the higher the success in intervening such epidemiological situations. And I know you can relate to this, especially right now in times of pandemic, when there are people who don't follow minimum health standards. So the higher the chance that really the disease will spread, or the infection will spread. Proceed model again is a very comprehensive structure, very comprehensive model. It assesses the needs for designing, for implementing, and evaluating health promotion activities and other health public health programs. Proceed phase, the phase 1 provides the structure for planning a targeted public health program, while proceed, on the other hand, is the phase that provides the structure for implementing and evaluating the public health program. Again, precede is for planning a program. Proceed is for implementing and evaluating the health program. As you can see, there are 8 phases in the diagram. Proceed as proceed as being mentioned earlier, stands for predisposing, reinforcing, enabling constructs in educational diagnosis and evaluation. And we have the following factors. One is social assessment. So when you say social assessment, you are going to determine the problems of the community and also their needs. Okay, and second is epidemiological assessment. You identify the determinants, the factors of identified problems, and you set priorities and goals. Third is ecological assessment. So we have social assessment, epidemiological assessment, and ecological assessment. This is the analysis of determinants that predispose the behavior and lifestyle, okay, of the community. Okay, and these are identified. There is also a policy that matches, okay, appropriate interventions. Then proceed. Proceed stands for policy, regulatory, and organizational constructs in education and environmental development, as we mentioned. Okay, this phase involves the identification of desired outcomes and program implementation. So implementation, if you can see it in the screen, this pertains to designing interventions, looking for resources, and implementing the program. While process evaluation is the determination if the program is reaching the targeted population and achieving the goals. So in other words, if the program is successful or not. Okay, impact evaluation is evaluating the change in behavior, the impact, okay, the effect, the change in behavior. So you are going to evaluate that. Then we have outcome evaluation. You identify if there is a decrease in the incidence or prevalence of a certain negative behavior, or increase in identified positive behaviors, okay, on a certain program. It is important to remember that components of the plan, okay, may be adapted over time as needed, and these plans or the planning can of course be flexible. Okay, it depends on the epidemiological situation. Okay, so it does not mean that your plan A will be rigid, will be strictly followed over time. So it changes. Okay, it should also adapt with the changes. Then for proceed, I just would like to emphasize, okay, some concepts here that pertains to the different phases. Okay, again, for proceed, it has 4 phases. Okay, implementation, process evaluation, impact evaluation, and outcome evaluation. So this is an acronym. Okay, precede and proceed. Precede has 4 phases. Proceed also have 4 phases. The precede phase is started with social assessment, epidemiological assessment, ecological assessment, okay, and implementation also of the interventions. Okay. For proceed, we have the implementation phase, process evaluation, impact evaluation, and outcomes evaluation. So just a tip, if ever you really need to study more on these concepts, there are lots of resources on the internet and your textbooks and other explanations that can provide other explanations. Um, this YouTube channel, this playlist, um, is also just an additional resource from what you are learning in school. Again, it's better if you complement it with reading books and listening and engaging in the discussions of your teacher. Okay, so this ends our discussion, our presentation on the four selected theories related to health education. So I hope you learned something, and be safe, be healthy, be protected. And again, this is your email, your online nurse educator, saying God bless. Thank you so much.